Okay, you guys good? Okay, welcome everybody. If you could take a seat, please. That would be great. We're going to get started. We're going to apologize for being a little bit late. It's been a bit hectic this morning for us, for reasons that don't matter anymore.
Well, we all sympathize, and is survival a new word? Or was it always there?
Interestingly, there was a change in title fairly recently, but it was before Saleh's recent flood. So we title of our presentation and what we are excited to present to you today is, so you want to design a curriculum, 3 survival tips to help you on your journey. As a disclosure statement, neither of us have, or none of us has actually designed a curriculum previously. So I think that's important for you guys to know. Having said that, I think that we are all in a situation where we may become future program directors. We have interest in program development. For Saleh specifically, he believes he may be forced into a position of leadership or curriculum development in the future. So I think this is a very relevant topic to all of us. Having said that, the goal of today's talk is not that you will be able to design a curriculum. It's more tips for beginners like us in terms of when you move forward, things to think about as you approach any of your new roles in the future.
Eugene, just for
yes.
One official photo. It's always so nice to have that. You're standing at the front and smiling.
Make sure that sounds well.
Make sure.
So I just, because your face was in the shadows. You're standing in front of everybody's name. So you actually need to stand beside the screen.
Beside the screen, okay.
Beside the screen, looking at me, so that I can see some the lights on your face, but you're not obscuring your excellent lighting.
So you have to smile.
No need. No need to smile.
Great. And just as in terms of another point, you can see from the Survivor logo, outwit, outplay, and outlast. That is not what we're talking about when we talk about designing a curriculum. Really, we hope for a more collaborative approach altogether, but we'll get into some of that. Okay, so our first task is really just an icebreaker. We want to kind of get the morning started. And this is going to be a think, pair, share activity. So let me just count 1, 2, 1, 2, 1, 2, 1, 2. So if you could just pair up with the person beside you. And Christine, I guess you could pair with Helen. Oh, okay, perfect. Welcome. So we're starting with an icebreaker, and we'd like you to think about a course, a seminar, some sort of learning activity that you've attended or been a part of. And all we want you to do is really think about it and tell the person next to you what you liked about it and why that was such a special course, seminar, learning activity. It can be related to medicine, but it also does not have to be related. For example, my example would be myself and my son playing, doing a learn to play hockey together, and that being a really nice learning activity because we were able to do it together, and it was very inclusive for parents actually. So, Farah.
But I think that interested in all of us. I think it's very important.
Right.
It's always good.
You don't hit that
If
same
you
thing.
forget your pediatrics questions, that's okay. As long as they don't have kids.
Okay, great. So I hear the voices quieting. And if you don't mind just sharing, I think we have enough numbers that probably everyone could actually share their story. So if we don't mind sharing with Nasser.
I chose the recent workshop that we did with Shirley Lee, probably because it's the most recent thing in my mind,
Yes.
but I thought that was an amazing 3 hours of actually not only learning how to do a good job, but then seeing it happen in front of you.
I agree.
And I thought that was fantastic, like to be able to participate and not feel burdened by the fact that you have to do so many interactive activities and yet learn at the same time about how to do them and how to present a good workshop. So that for me was very helpful.
Yes, it was very good.
So for me, I thought of, I went to an Emerge conference a couple years ago, and one of the sessions was on, it was very visual, it was like a spot diagnosis, check your answer, but then also would give you a couple of pearls along the way. But it was fast-paced, it was interactive, it was visual, which is appealing, and the pearls kind of missed the content, so it was really useful, it was engaging the whole time.
I picked the 3 years ago. I went to the American Society of Nephrology, knowing very little about kidney biopsies and pathology, which is not easy, by the way. And in 2 days, they were able to give us a crash course so that we could recognize all the common biopsy patterns, because we were hands-on with a kit of slides and that we could look ourselves. And like the lectures were never more than like 20 minutes, and then you had like 35 minutes of hands-on activities. They had some non-identified microscope slides you can go and see and identify, which was kind of a game. You could win prizes. There were 5 kidney pathologists, nephropathologists going around for about 40 people, so you really had support. It was great for something that is probably not easy to build in 2 days. I would have run it for several years, so I guess practice makes it good, but it was quite amazing how you could do it.
No, that sounds very impressive. And your topic of love, right? Nephrology, which is.
But I'm not a pathologist, though.
Right. I'm just saying, someone else that doesn't have the same love for nephrology may not have enjoyed the microscopes as much. I'm just kidding.
That's a possibility.
Annika?
Yeah, I've attended some surgical skills training workshops here for residents in ophthalmology, and what impressed me was, the level of, they are so well organized, and even though they have a whole lot of resources, so for example, they have 4 phaco machines, which is like, wow for me, coming from it, just for practicing on non-patient, on artificial eyes or fabric eyes. So on one hand, it's that, and on the other, you can also make do with, low fidelity or cheaper things, but I think the organization, according to the level of the learner and the way they are set up for progression before they go to patients.
Right, it's sort of personalized, it sounds like. That's great.
So I just went to a geriatrics conference in Edmonton a few months ago, and I think it was really nice because it was just for residents. We had charismatic speakers from all across Canada. We had small group activities, and I think the speakers were able to address our needs and kind of improvise the lectures on the spot, which was really nice. I thought it was really engaging, interactive, really tailored our needs as well.
Wonderful. So the engaging, the innovation, that was all made it exceptional. Good stuff.
So I participated in for leadership for the first year of the DFCM Leadership Conference earlier this year. So sort of voluntold to do it. But it was good because it was things I otherwise would not have likely exposed myself to. And I'm glad that I did, because it was just like a lot of inspirational speakers from different levels of leadership and kind of how to get involved in whatever phase of your career that you're in.
Great.
So,
Wonderful. I'd like to welcome the latecomers. If you don't mind just filling out the name tag. No, don't apologize. We were late actually, so we can't blame for that. Emily.
I just finished part of the course this weekend. They basically used every tip that we've done so far in this course, so it was really good.
Fair enough.
Very engaging.
I had talked about my prenatal and baby care course, which actually I would say the reasons why I liked it is very similar to this course, because when I think about the elements, one, the material was highly relevant, so I already sort of went in like very motivated for the topics. And then the other thing is that just the way that it was structured is similar to this. Because it was always about 4 hours, which is a large chunk of time, but there was always like nourishment, there were always like built-in breaks. There was a combination of like videos and interactive like group activities with chart paper, and then like sort of like other sort of role-playing things.
Yes.
And so yeah, I just like that sort of different combination.
Right, I agree completely. Okay.
I'm going to introduce Gwen. Gwen
Yes.
Sampson is a graduate of the Whole Masters. Star graduate. And she's here at my request because I need to work with people who will one day replace me. Gwen is on the list. So Gwen is here to work with me and enjoy your workshop. I don't think you did a workshop on Christmas. No. Gwen has been through this experience herself, as has Annika.
So, I mean, some of the themes that came up from some of the programs and courses you guys created were really enjoyed. They were engaging, they were hands-on. They used a lot of the tools we've used and just very recently based on Annika's presentation, and I 100% agree. It's really neat, as Nasser said, to see these being implemented so quickly within our own teaching sessions. And I think that I agree with you, Nasser, that was one of a very powerful presentation for myself as well. Thank you so much for sharing that.
Before we start our workshop, I mean, I don't know if you didn't mind to take pictures from the team during the workshop. You're okay? So in our workshop, we try to clarify, I mean, the classic approach for any curriculum design, which we choose one of the modules called the 6 steps involvement in the curriculum development, and we try to identify these steps. The last 2 things we will discuss it today, or I will try to open, I mean, our eyes on it, which is usually not involved in the classic curriculum, which is, I mean, one of them is the interprofessional educations and the leadership. Usually they are, I mean, in the last 10 or 15 years, most of the organizations start to, I mean, recognize the importance of these and try to implement these in their curriculum, but still they are facing problems or barriers at the different levels, either at the level of administrations or, I mean, teachers or the learner. So now what we are going to do, try to get way or others to implement these in the curriculum during the workshop, and we'll try to explore the importance of these 2 things, which is usually not involved in the classic curriculum.
Sure. All right, so our next slide is, we're going to do a case, actually. So Nasser's handing it out right now, but we want you to look into the future, look into that crystal ball, and we want you to imagine that you are a newly hired program director, just hired to a new faculty, as a new faculty member. And within this position, you have found out that, unfortunately, last year, 3 out of 10 of the last learners, they can be residents, they can be physiotherapy students, they can be nursing students, but unfortunately, 3 out of 10 learners actually failed their final exam. And you were hearing murmurs of disgruntled people, and especially the students that you have been involved with. So you've been given the daunting task by the medical director to revamp the program, actually. So this is obviously not an easy task to do, but unfortunately this is very realistic within our healthcare environment and within our program curriculums. And I have seen this within my own programs as well, so unfortunately this is not an unrealistic case. But all we want you to do is, we're going to get you into groups, and we want you to come up with 6 steps, 5 or 6 steps actually, that you want to go through in order to tackle this problem, in order to approach this problem. So to create somewhat of an approach. So we will get you into groups. You're not in a group? Okay. Melanie is. So we're just going to do numbers. 1, 2, 3. Kristen, you're 1. Go 2, 3. 1, 2, 3. So if you don't mind getting with your number and the task. And we'll give you about 5 minutes to talk and maybe come up with 2 penalties. Some sort of action.
So can I just
Yes.
ask you this example because it kind of makes a difference for me? Is
This is what just
That's
Ready?
Of course, that was me.
I know, that's the right.
Okay, you guys good? Okay, welcome everybody. If you could take a seat, please. That would be great. We're going to get started. We're going to apologize for being a little bit late. It's been a bit hectic this morning for us, for reasons that don't matter anymore.
We all sympathize, and is survival a new word? Or was it always there?
Interestingly, there was a change in title fairly recently, but it was before Sully's recent flood. So title of our presentation and what we are excited to present to you today is, so you want to design a curriculum, 3 survival tips to help you on your journey. As a disclosure statement, neither of us have, or none of us has actually designed a curriculum previously. So I think that's important for you guys to know. Having said that, I think that we are all in a situation where we may become future program directors. We have interest in program development. For Saleh specifically, he believes he may be forced into a position of leadership or curriculum development in the future. So I think this is a very relevant topic to all of us. Having said that, the goal of today's talk is not that you will be able to design a curriculum. It's more tips for beginners like us in terms of when you move forward, things to think about as you approach any of your new roles in the future.
Gene, just for
Yes.
one official photo. It's always so nice to have that. You're standing in front and smiling.
Make sure that sounds well.
So I just, because your face was in the shadows. You're standing in front of everybody's name. So you actually need to stand beside the screen.
Beside the screen. Okay.
Beside the screen, looking at me, so that I can see some of the lights on your face, but you're not obscuring your excellent lighting.
So you have to smile.
No need to smile. Thank you.
Great. And just as in terms of another point, you can see from the Survivor logo, outwit, outplay, and outlast. That is not what we're talking about when we talk about designing a curriculum. Really, we hope for a more collaborative approach altogether, but we'll get into some of that. Okay, so our first task is really just an icebreaker. We want to kind of get the morning started. And this is going to be a think, pair, share activity. So let me just count 1, 2, 1, 2, 1, 2, 1, 2. So if you could just pair up with the person beside you, and Christine, I guess you could pair with Helen. Oh, okay, perfect. Welcome, welcome. So we're starting with an icebreaker, and we'd like you to think about a course, a seminar, some sort of learning activity that you've attended or been a part of. And all we want you to do is really think about it and tell the person next to you what you liked about it and why that was such a special course, seminar, learning activity. It can be related to medicine, but it also does not have to be related. For example, my example would be myself and my son playing, doing a learn to play hockey together, and that being a really nice learning activity because we were able to do it together, and it was very inclusive for parents actually. So, Farah.
But I think that I think it's very important. As long as they don't have
Okay, great. So I hear the voices quieting. And if you don't mind just sharing, I think we have enough numbers that probably everyone could actually share their story. So if we don't mind sharing with Nasser.
I chose the recent workshop that we did with Shirley Lee, probably because it's the most recent thing in my mind,
yes.
But I thought that was an amazing 3 hours of actually not only learning how to do a good job, but then seeing it happen in front of you.
I agree.
And I thought that was fantastic, like to be able to participate and not feel burdened by the fact that you had to do so many interactive activities and yet learn at the same time about how to do them and how to present at a workshop. So that for me was very helpful.
Yes, it was very good.
So for me, I brought up, I went to an Emerge conference a couple years ago, and one of the sessions was on, it was very visual, it was like a spot diagnosis, shut your answer, but then also would give you a couple of pearls along the way. But it was fast-paced, it was interactive, it was visual, which is appealing to me, and one of the pearls kind of risk content, so it was really useful, it was engaging the whole time.
I picked the 3 years ago. I went to the American Society of Nephrology, knowing very little about kidney biopsies and pathology, which is not easy, by the way. And in 2 days, they were able to give us a crash course so that we could recognize all the common biopsy patterns, because we were hands-on with a kit of slides and that we could look ourselves. And like the lectures were never more than like 20 minutes. And then you had like 35 minutes of hands-on activities. They had some non-identified microscope slides you can go and see and identify, which was kind of a game. You could win prizes. There were 5 kidney pathologists, nephopathologists going around for about 40 people, so you really had support. It was great for something that is probably not easy to build in 2 days. I know they run it for several years, so I guess practice makes it good, but it was quite amazing how you could do it.
No, that sounds very impressive. And your topic of love, right? Nephrology, which is.
But I'm not a pathologist, though.
Right. I'm just saying, someone else that doesn't have the same love for nephrology may not have enjoyed the microscopes as much. I'm just kidding.
That's a possibility.
Annika?
Yeah, I've attended some surgical skills training workshops here for residents in ophthalmology, and what impressed me was, the level of, they are so well organized, and even though they have a whole lot of resources, so for example, they have 4 phaco machines, which is like wow for me, coming from it, just for practicing on non-patient, on artificial eyes of the epic eye. So on one hand, it's that, and on the other, you can also make do with, low fidelity or cheaper things, but I think the organization, according to the level of the learner and the way they are set up for progression before they go to patients.
Right, it's sort of personalized, it sounds like. That's great.
So I just went to a geriatrics conference in Edmonton a few months ago, and I think it was really nice because it was just for residents. We had charismatic speakers from all across Canada. We had small group activities, and I think the speakers were able to address our needs and kind of improvise the lectures on the spot, which was really nice. I thought it was really engaging, interactive, to tailor our needs and stuff.
Wonderful. So the engaging, the innovation, that was all made it exceptional. Good stuff.
So I participated in the leadership for the first year of the DFCM leadership conference earlier this year. So sort of voluntold to do it. But it was good because there was things I otherwise would not have likely exposed myself to. And I'm glad that I did because it was just like a lot of inspirational speakers from different levels of leadership and kind of how to get involved in whatever phase of your career that you're in.
Great.
So,
Wonderful. I'd like to welcome the latecomers. If you don't mind just filling out the name tag. No, don't apologize. We were late actually, so no, we can't blame for that. Emily.
I just finished part of the course this weekend. They basically used every tip that we've done so far in this course, so it was really good.
Fair enough.
Very engaging.
I had talked about my prenatal and baby care course, which actually I would say the reasons why I liked it is very similar to this course because when I think about the elements, one, the material was highly relevant, so I already sort of went in like very motivated for the topics. And then the other thing is that just the way that it was structured is similar to this. Because it was always about 4 hours, which is a large chunk of time, but there was always like nourishment, there were always like built-in breaks. There was a combination of like videos and interactive like group activities, like a chart paper, and then like sort of like other sort of role-playing things.
Yes.
And so yeah, I just like that sort of combination.
Right, I agree completely. Okay.
I'm going to introduce Gwen. Gwen
Yes.
Sampson is a graduate of the whole star graduate, and she's here at my request because I need to work with people who will one day replace me. Gwen is on the list. So Gwen is here to work with me and enjoy your workshop. I don't think you did a workshop on prenatal. No. Gwen has been through this experience herself, as has Annika.
So, I mean, some of the themes that came up from some of the programs and courses you guys created were really enjoyed. They were engaging, they were hands-on. They used a lot of the tools we've used and just very recently based on Annika's presentation, and I 100% agree. It's really neat, as Nasser said, to see these being implemented so quickly within our own teaching sessions. And I think that I agree with you, Nasser, that was one of a very powerful presentation for myself as well. Thank you so much for sharing that.
Before we start our workshop, I don't know if you didn't mind to take pictures for the team during the workshop. workshop. Okay. So in our workshop, we try to clarify, I mean, the classic approach for the any curriculum design, we chose one of the modules called the 6 steps involvement in the curriculum development, and we try to identify these steps. The last two things we will discuss it today, or we try to open, I mean, our eyes on it, which is usually not involved in the classic curriculum, which is, I mean, one of them is the interprofessional educations and the leadership. Usually they are, I mean, in the last 10 or 15 years, most of the organizations start to, I mean, recognize the importance of these and try to implement these in their curriculum, but still they are facing the problems or barriers at the different levels, either at the level of administrations or, I mean, teachers or the learner. So now what we are going to do, try to get way or others to implement these in the curriculum during the workshop, and we'll try to explore the importance of these two things, which is usually not involved in the classic curriculum.
Sure. All right, so our next slide is, we're going to do a case, actually. So Nasser's handing it out right now, but we want you to look into the future, look into that crystal ball, and we want you to imagine that you are a newly hired program director, just hired to a new faculty, as a new faculty member. And within this position, you have found out that, unfortunately, last year, 3 out of 10 of the last learners, they can be residents, they can be physiotherapy students, they can be nursing students, but unfortunately, 3 out of 10 learners actually failed their final exam. And you were hearing murmurs of disgruntled people, and especially the students that you have been involved with. So you've been given the daunting task by the medical director to revamp the program, actually. So this is obviously not an easy task to do, but unfortunately this is very realistic within our healthcare environment and within our program curriculums. And I have seen this within my own programs as well, so unfortunately this is not an unrealistic case. But all we want you to do is, we're going to get you into groups, and we want you to come up with 6 steps, 5 or 6 steps actually, that you want to go through in order to tackle this problem, in order to approach this problem. So to create somewhat of an approach. So we will get you into groups. You're not in a group? Okay. Melanie is. So we're just going to do numbers, 1, 2, 3. Kristen, you're 1. Go 2, 3. 1, 2, 3. So if you don't mind getting with your number and the task, and we'll give you about 5 minutes to talk and maybe come up with some sort of action plan.
So can I just
Yes.
take this example because it kind of makes a difference for me? Is
sorts of problems and figure it out. What are the different ways you could actually talk to people about this problem? Do you guys have any thoughts or ideas about how you would approach this? I think I heard talking to the learners. How would you go about doing that? How would you approach them?
You can do a multitude of things. Like you could start with maybe anonymous surveys, and then maybe like one-on-one faculty meetings with your mentors or something like that, and then having full-on group discussions. I just remember when DFCM went through its accreditation process last year, Jess and I were both residents at the time, and I think most of us probably were. And it was like multiple steps to actually get down to discussing it with, like, so we had, I think we had our own, I want to say, chief meetings, we had our own program director meetings, and we had a big accreditation meeting where everyone was given an opportunity to voice their opinions.
What do you think the value is of sort of having all these different ways of talking? Do you think there is?
I think different people just respond or feel comfortable talking in different environments, using different means.
Absolutely. That's great. Any other thoughts about that?
I want to bring someone on the outside that is impartial, because I'm not sure learners are going to talk to either you or other staff members about your own weaknesses. And then this person from the outside could give it back to you anonymously. So that way it protects the students, and then they might talk. Some of them might let them talk with this. But if you want to see what the problem is, I think it's probably the way to go. You could do it in a minute survey, but you get so many surveys, I feel they are not going to talk as much. If they're as a group with one or two outside people, maybe like a resident like them, or a student in nursing or whatever, and a staff member from elsewhere, then they might be more open to this issue.
I still really struggle with this one because I've seen like several programs go through this where there has been, let's say, an external review where people actually finally do feel comfortable with voicing their concerns, and then the program getting so angry with what that feedback was and actually calling each individual resident and basically bullying them to say who said what at this meeting and why are we, not getting our full accreditation. So, and or other situations where they call for these meetings for people to give feedback in supposedly safe environment, and where everyone just kind of smiles and says everything's fine, when in the background everyone is really unhappy. So I don't know. I still can't wrap my head around this like a good way to do this, because I really struggle with it.
Yeah, I think it does speak to the idea of a safe environment, actually, ensuring that learners truly do have that safe environment that they can speak openly in. And from a program director perspective, you hopefully have someone that is responsive and really advocating for the learners themselves.
I think part of the problem always is dependent on the sample size.
Yeah.
So if you're in a teeny tiny program, it's much harder to keep everybody safe. And that's the kind of situation where sometimes you have to collect data over 2 or 3 years and wait until one cohort is left, or else if you've got a cohort that's continuing over a 4 or 5 year program, you have to collect the data together over, say, 3 years, or even sometimes 5 years, and then mash it up together. And there actually are statistical ways to do an ongoing rolling mashup. And you have to get into that kind of complexity if you have such a small sample size.
I think that's true.
Just another point, I think, sitting at a table and coming up with the issues is important, but actually directly observing that interaction.
Yes.
And I think if students have a complaint that, the teaching wasn't great, maybe having an external review that Matthew mentioned, just to see, what's happening and where the gaps are in practice.
Yeah, I think there's huge value to that independent observer, or someone that's sort of outside of that kind of what can be an enmeshed sort of relationship between the learner and the teacher. Yes, go
So
ahead.
I'm just going to say that I do like the concept of focus groups for that reason, because when you have a situation where people are smiling, it only takes one outspoken person to get everybody to finally say something.
It's true.
So I don't know, I like those, because usually people will, well, in my experience, people will back you if they agree. If you're completely out in left field, then there's value in that as well. If it's just like the cheese standing alone.
Yes.
Or is it like, other people are rallying behind this person, so maybe it's a legitimate issue?
I think that's true, actually. Getting that one person to start the ball rolling kind of thing, I think that does get the learners and people involved. The only other thing I would say, you've actually covered all of these different areas, is that sometimes part of this is just needing something in writing and something that's more formalized, and that is another reason for some of these external audits and things that actually occur as well, just so that there's a record. So the next step, step 2, according to Kern, was the needs assessment of targeted learners. This is a more specific needs assessment, whereas the first one was kind of identifying the problem and the general needs. I think all of you came up with needs assessment within your steps, but you really want to first obviously identify who the learners are that you are trying to help. In our case, it was the students or residents or whoever it was that you decided was needing help with the exams. Really, when you talk about the information that is needed about each learner, the Group 1 again actually went through all of these issues that I've already put out on the slide. But really, what you need to know about the learners is what are they actually doing? How are they performing? Where are they strong? Where are their perceived deficiencies? And then on top of that, you want to figure out, you want to personalize their program a little bit. Figure out their learning styles, their preferences. Figure out what barriers there are within your specific program. What are the things that are good about the program or enablers that can help you move forward? And then again, resources becomes a big issue when it comes to trying to figure out all the issues that are involved in targeting your needs of your specific learners. Third step is, again, I think most groups came up with this one as well, was coming up with goals and objectives. I'm not going to speak a lot to this. Oh, this slide is missing a picture. This was a car over here. It's a very small-looking car that would be considered the slide is kind of lost a little bit, to be honest. But it was a smart car. So what we want are smart objectives, obviously. Nasser and I had a bit of a discussion between what goals are and objectives are, and there is a difference depending on what you read and who you talk to. A goal is sort of a general idea statement, something that you want to accomplish, but the objectives are really what we consider specific, measurable, attainable, realistic, and time-based in order to come up with something specific. Now, when we were actually, we've all kind of done this, and I think this is always a work in progress for probably most of us, unless you're really well trained in coming up with good objectives. But I think, at least for my learning contract, despite my
So this is the car, by the way.
Appreciate that, Nasser. Despite a lot of practice, this is the kind of skill. Coming up with a good goal and objective actually becomes vital to coming up with a good curriculum, and really needs to be reevaluated, as I already mentioned.
So would you agree that the goal is the final end point? Like whatever your vision is, that's your goal of where you want to be?
Yes, I would agree.
In the end?
Yes. And then objectives can be sort of parts of the goal.
So they are completely different.
Right, but
I mean, a lot of people get mixed up.
That's what I'm saying.
But
Yeah.
none of you will.
But when you read, I mean, and I think that not just us get it mixed up, but when you actually read, you certainly see people mixing up the terms all the time. So I think that it's important to be aware that that happens.
So that's why with the learning contract services, in my example, so your goal is Chicago.
Right.
Right. The objectives are everything you have to do to get to Chicago.
Right. That's great. When we come up with goals and objectives, the objectives and goals can actually involve the learner, the process, or the outcome. For example, the learner goal in this class would be, hopefully by the end of this curriculum, you will know 4 out of 6 steps that we've gone through. Process goal would be, for example, just say you are actually, you've developed a curriculum and you've had a previous poor attendance within your curriculum, so maybe only 50% of learners have been showing up. So a process goal would be that hopefully with the changes you make, 80% of learners will start coming to your classes. An outcome goal would be more along the lines of, again, maybe with our case, where we had 30% of learners who actually failed the exam. Trying to adjust that to maybe like a 10% number or that kind of thing.
Can I ask something?
Yes.
Do you think it's hard to design goals each domain for one project?
Do I think it's hard? Yes.
So if you have this scenario that you posed, and your goal is to, say, improve the program,
Yes.
it would be it's almost like a different work each time. Just so you think, I'm going to work on the goal of the outcome, I'm going to work on the goal of the process, I'm going to work on the goal of.
I agree.
So
Yeah.
it'd be-
No, and I think that although it is difficult, it makes the rest of the steps easier if you actually come up with a good focused goal and objective that's attainable. Whereas, you know, sometimes we do sort of, certainly for me, I kind of overshoot a little bit at times, and I think that I need to kind of, you know, get back to back to level grounds at times as well with these goals. So yeah, I agree. It is hard, but and I think sometimes it's just kind of a pass-over thought to come up with a good objective or goal, but absolutely important in any of your future learning activities, actually, in general. The next step is education or educational strategies. You know, I didn't really necessarily hear this as a big step, but this is actually a huge step when it comes to the overall curriculum design. Education is obviously the heart of a curriculum, and you know, put very simply, it involves the content and which is the material, and the methods, which is the way that the content is presented. Now, I think that a good way to think about the education would, you know, this is the kind of thing that could be like 10 talks. So I decided to just kind of mention it as a very, very, very important step. And hopefully in future learning and workshop activities, you are able to address the learning needs of your learners with different educational strategies. But this is the part that we can really change, is the methods part of it. The content basically stays the same no matter where you are. It changes a little bit based on evidence, obviously. Implementing the goal is the fifth step. Sorry, implementing your educational strategies is the fifth step of the current. And really, in order to implement a program, you need to, once again, identify the resources that you have. This could be people, this can be the space and building that you have, as well as money and time. You need to know all of these things before you actually implement whatever strategy you intend to perform. Support becomes a huge part of moving a program forward. There's sort of the internal morale sort of support that comes from administrators, faculty, learners, and there's obviously the more external support that comes in the form of financial aid, government grants, private donors. Sometimes the private donors are coming from internal faculty members as well. It's important to note. And then you want to know how you're actually going to administer the actual program. And for me, this was, when I read about it, it's kind of like your big instruction manual, like, you know, that big, you know, 2,000-page document that goes through, you know, part 1A, B, C, D, E, and then part A, B, -2. And really, like, or a rules book, for example, and for like a sport like hockey or that kind of thing. This is your organizational structure and your policy manual, basically. So you would need numerous players within the leaders of the program, as well as members from different levels of the program, in order to figure out what the administrative structure is, how you're going to actually make the decisions in the future. You need a good communication system throughout the administration, and again, you need this operations manual, this sort of book of how to do everything that you want to do. And this is a very, I don't want to say tedious, but it's an arduous process. It's a hard process. And finally, the sixth step, a very important step, is that you want to evaluate. You want to create evaluation and feedback, and this is probably, you know, it should almost be like a bold arrow between each one of these steps, because this is extremely important within each step to evaluate and perform feedback throughout your steps.
Eugene?
Yes.
I didn't know this before on Kern, but one of the things I can see is that what Diamond had was Diamond had that nice link between implementation and evaluation.
Yes.
And here it's missing. So between each one of these, I mean, it's not as complex as it needs to be. There actually needs to be, along with the bold arrow you just described.
Yes.
There also needs to be an up and down arrow.
I hear what you're saying.
Particularly between implementation and feedback, because if you don't build implementation into your evaluation.
Yeah, there actually is an arrow there. It's just covered by my block, so but it's not full. So that's a slide error. But yes, each of these is an arrow to each other one actually. So yeah, but it's a very valuable point actually. That this is very important. So I'm just going to give a special thanks to Dr. Maddie and feedback groups 1 and 2 to really cover this more thoroughly because truly this is a very important part of the task, and we're lucky enough that we have some workshops already designed to look at these more specifically. Sort of to conclude our 6-step process, really you can start at any step based on where you are in your curriculum design, but most of the time you're starting at what's the problem, coming up with specific needs, coming up with goals and objectives, your educational strategies, implementing, and then your evaluation and feedback of that whole program itself. And with that, I think it's a nice time for a break, and please take the next half hour to enjoy coffee, juice, water, donuts, or
You know what? I think it's a long time.
30 minutes, yes. So please be back in half an hour.
I would like.
Or out of page. Hello.
Hi, hello, I'm
Eugene
Sherry.
on Unit 8.
Eugen?
Yes?
Yeah, how are you, Eugen?
Doing well.
Yeah,
Dr.
good,
Ashari?
good. How are you too?
So you have, I think you have a medical student or someone like that on the unit. They said they were supposed to meet you.
Oh, really?
Yeah.
That's my calendar, I'm busy now with my meeting, so let me talk to them, please.
Okay. Yeah, Nasser. Sorry, yes. Nice. There you go.
Hi, Dr. Sherry. Good morning.
Hi, Nasser, how are you?
Good. I'm the international
Tell
fellow.
me something about yourself, please.
Yeah, I'm the international fellow supposed to meet to join your team. I started today, and I received an email from your secretary that I should meet you in the ward at 8 a.m.
Oh, really?
Yeah.
I completely forget that. Sorry for that. I'm very, very busy now with my meeting now, so I think maybe I'm going to meet you afternoon. Is it okay?
It's okay, but what I should do now?
Ask Eugen, look at the files and help yourself. You are full already. Bye.
Thank you, Bye. Excuse me, so what's your name again?
Eugene.
Eugene, hi.
Yes.
Eugene.
Hi.
So how can I know which files belong to Dr. Shehri?
Oh, the files. Well, Dr. Al-Shari and Dr. Brown are the 2 staff doctors on the unit. So you have Dr. Brown. He has a brown dot beside each patient name, and Dr. Al-Shari is the black dots actually. Okay.
Excuse me, please.
Yes. Yes.
How can I review the chart and how can I read it actually?
Well, this is the progress notes over here. My nursing notes are in the nursing section over here. The the medications are over here. I keep my vital signs over on this page. Okay, so just so they're all up to date. No one has any acute problems, but just let me know if there's any issues. Okay, and I'm happy to help you. Okay.
Yeah. How can I do around being somebody to join?
Usually the fellows they're rounding on their own actually. So.
Since I'm new here and just joined today, I have no idea. I'm disoriented actually.
Okay. Well, I am happy to help out when you see the patients. Okay, but you know, in all honesty, I actually have a couple of things I'm doing actively for the unit. I'm sorry, I might not be able to help you, but please let me know if there's any active issues, and I'm very happy to help you. Okay. Okay.
What's up? I hate cannabis.
Okay, I think this afternoon now. Excuse me. Where is Eugen? Eugen!
Hi.
How are you?
Dr.
Are you happy?
Good to see
I'm
you.
happy.
I'm
You're happy.
happy.
How are you?
Yes.
Yeah.
Doing great.
How's everything here?
Going well, thank
Everything
you.
stable?
Yes.
Everything okay here?
The patients are stable. Yeah.
Can I go home now?
No.
Oh, no. Okay, sorry.
Well, I don't know.
Okay. Okay. I think you told me about one. His name Nasser.
Yes.
By the way,
Right over.
I don't know his picture. I don't know.
That's okay. He's right over there. He's just.
This
sitting
one.
right
Oh, Nasser, how are you?
Hi.
Yeah, hi, Nasser. Your picture is a little bit different than what they have in the file. Okay. How's everything? Are you happy? I'm happy. Everyone happy. Yeah.
I don't know. This is my first day here. I'm already disoriented. I don't know anything
Oh, really?
actually. Yeah.
Did anyone do for you any orientation here or anything?
Actually, no. Even I didn't have an ID.
Oh, really?
Yeah. So.
You know, that's okay. So are you ready now to do the round with us now?
I don't know actually anything.
Oh, really?
Yeah, I just reviewing the charts and.
Okay, so today, by the way, join to us and see what's the work going on there and look to the fellow, look to see how it's work. So you're going to start your work from tomorrow. Is okay?
It's okay.
Okay.
Okay. Thanks. Who's the best actor, by the way? Who is the best actor? This is the question. So now you see this interaction between different professions, and so what's the communication issues did you witness, and how could you create a more ideal orientation to the unit for the learners? I think each one has an colored stickers with numbers, so you can sit as a group of two.
Oh.
Yep.
No. Next year is two, but I don't know where she is.
She had to leave.
Oh, she had to leave?
Yeah.
Okay.
So yeah, so we are 8. So yep.
Which one?
1. There is
Do you want to
3
do
ones.
this again?
Yeah, no, I can join.
Oh,
Yeah. Yeah.
Oh,
Join
she's
her.
already-
Yeah. Join Christine because she is yeah.
I know it as well.
So,
She gets here.
First day in
Nasser, do you split in pairs or?
Yeah, we can.
You can have a
No,
group of
2. Yeah, because you are 8, I think. So
Yeah.
2.
Oh, there's two for 6. Oh, you're right. Two each.
You go to the birthday of your best friend.
Either because the guy didn't put it in his schedule or there was miscommunication there.
So the nurse did a job.
But even the doctor was not aware that he didn't.
So you like that you first not only to the country but to the ward.
So lack of communication from.
More, again, you kind of should be in charge of explaining you receive additional help all the more active. All the just say you look at a food chart here.
Or nurse, not aware, didn't buy doctor in order.
Thurlow has unclear instruction.
So,
I'm happy.
Lack of orientation.
Take the picture for you.
Plan for time.
Yeah, you often find that presentations like the day of you start. It's never ever compared to like okay, designated versus already and this I think was a pretty people are when did you do it? Like it's almost those things on the chart before, always before.
So almost like
U of T should have a common database that has all this. You're searching through what you're seeing.
Right, so they
Maybe secretary
and again, take that before.
Well, you did a cross
So
there's a hype. I guess the hyphen makes it look like the professions are split apart and work in different columns, as opposed to the two words together make it look like they actually work together. You know, in French, it's a little bit different. It might be interesting. We don't have this hyphen difference in between the two, but some of them call it like multi-professional team, which is a multitude of professions, and some call it interprofessional teams. And I think it says a lot of what your team will actually do.
We do have similar sort of concept, like they're multidisciplinary versus interdisciplinary. Yeah, absolutely. Yeah.
That's pretty much the same.
So in terms of those concepts, I think of them like the multi kind of working still in their individual silos, and occasionally two will collaborate by a phone call or whatever. And then interprofessional, I think of like more, you have that designated time where you are all face to face in a group, bouncing ideas off each other. So programs that I've seen this done well have been like eating disorders and addiction. They seem to have it down.
So an example that I would bring from when our medical students arrive in my area of family practice, the first morning is entirely blocked for orientation, and 1 hour is pre-booked with the team nurse. So the team nurse has protected time to orient the medical student to a list of things that the nurses have determined are very important for the medical students to know before they start to do anything. But the nurse's time is protected. Right? So that's interprofessional in the sense that then the medical students understand that in fact the team nurse is one of their teachers from the first day.
Any other ideas? Yeah, I mean, in the language per se, in the English language, there's no difference between, as Matthew mentioned that. The hyphen here making really barrier between the professions. So if we will use the second, line, it will be interprofessional. So really, that's the team we mean. So we are already embedded there, that team. So now I'm going to show you 4 pictures. which is I will ask you to choose one of them to be an icon for the interprofessional education. So started by, this is A, and this is B, and this is C, and D. And this is all the pictures here. So just, again, group together and try to choose one of these pictures and tell us why did you choose it, or why do you choose it. Okay, already in groups. So they skip it.
Is that what we want to
Obviously, the context of whatever it's trying to portray.
What I like to see is that
Maybe you didn't select the right time, right persons, right, place to implement that. So does it mean that if you score, very low, and in the levels, that is not that program. You have to evaluate, like what we mentioned earlier. If you have the residency program and 3 of them have been failed, you have to evaluate what's going on. There is something wrong. So all of us, that is shocked for all of us. Even at the administration issues, at the faculty members, or for the learner themselves. So 3 members failed. The final year exam, which means the 4 or 5 years which they trained, there's some deficient. So we have to evaluate and work on it. So this will be the last part of my sessions. So who's good in puzzle? None? So we try to see how is the team will work. Yeah. That I know it's for the age 3 to 7, but
So get into your groups, the ones together, 2s together.
So we'll distribute that. So 3 they will be in a group, and 2 will be in a group, and 1 group. So we'll see, and we'll time which one will finish fast.
Right. So there should be 2 group number 1s. So one of them will be a timekeeper. Out of the 3 group number 2s, 1 needs to be a timekeeper, and then there's only 3 group number 3. So one of us will timekeep you guys and see how fast you go. And don't start yet. Yeah, there's 2 ones.
Oh, there's 2 ones.
Only one of you does the puzzle. One of you does.
So we just be time. Oh,
Yeah, so we'll get you to all start at the same time, but you need to time each other. Do you have puzzles for it?
Yes, try to open it.
Do you need me to open it?
Yeah. They're brand new.
Who wants to be timed with her?
You are.
Yeah. 3 people.
Good start.
We're just gonna. Can we open the box?
So you are.
Oh, does everyone have a box? You guys have boxes? One person.
So 2 citizens be puzzled.
So you can open the box, but don't take them out yet.
But we need, no, we need somebody to do it.
Is it okay with the video here?
Yeah. Wow, that's the video. Oh, it's
There you go.
smooth. I really like it. Should I type it?
Where's the 3rd group 3?
There's no turn.
You know what they're doing?
I think there's the number.
This is a 3, and this is 2.
He's trying to prove that.
Yeah, teamwork, right?
Teamwork.
Oh, there's the smile. Oh, eyes. Oh. This one's here somewhere.
I did this, but also can.
Use the help from here. Use the help.
Please help me. Missing pieces.
Go ahead. I'll put this
Okay,
one.
good. 1 minute 18 seconds, or 1 minute
Wow.
20 seconds.
What? Are we done?
Yes.
You're a team. I actually
15-1.
Hi. Right. I think, yeah, you're right.
Need to-
If you were like, since you were doing the center, I was just
And I
helping
did,
the side.
I needed this, and this was helpful
did
too,
the top,
because
so,
we almost
yeah.
kind of worked on it based on where we were sitting. I'm like,
So, this, I mean, the virtual games can give us some version how the team work. I mean, definitely you can grade it 1 or 2 there, 3, 2, 1, but this is 1, 2, 3. So this is, I mean, reflecting really, if you are working as a team, you can definitely, some of the, I mean, importance of education to shorten the time, which is of the patient hospitality. So yeah, this is the real example.
This is we're talking about. And so those hospitals actually have different funding from the Ministry of Health because of the agreements that are set up through the Ministry of Education. And they're very technical legal documents. So it's actually pretty complicated. The community affiliated hospitals, then they're usually specified departments that have specified relationships with various education departments and areas. So you might have a hospital that has 3 departments affiliated with the Faculty of Medicine at the University of Toronto, and 1 department that's affiliated with a community college outside Toronto, for example. And not everybody in the whole hospital definitely has an affiliation with anybody else. And so it's different, and they have a different budget stream from the Ministry of Health.
I'm not very good. Okay, good morning very much, everyone. Actually, good morning very much. She had a story in my country, with a man from Germany. When he came, he can't speak English very well, so he combined it. The people said, tell him good morning, and some others say thank you very much. So he combined it together, so good morning very much. It started to be like a brand name. Welcome to the tip number 3 now. We work as a team, me and Nasser and Eugen, which is, I think they are like my brothers, actually. We work together, they are a great team. I don't know about myself, I can't go. So we came to the decision that's the 3rd tip about it. We want to talk about the leadership and the leading, and that's essential for when you start to build your curriculum. So 3rd tip is to enhance your ability to build your curriculum designing and help you in solving common issues by different solutions. Let me start by definition. I'm a person who likes Wikipedia. So from Oxford, the definition is the leadership definition is the action of leading a group of people or an organization, or the ability to do this. You can be a leader at work, at your home, your family, anywhere. In Wikipedia, it's more detailed. That's a process of social influence in which one person can embrace the right and support others in the accomplishment of common tasks. So, the history for the leadership, especially in the medical, it's a little bit starts since 1940s. That's what I looked at when I did my research in the books and the internet. So the concept of leadership had been changed over the cities, and actually it started since 1940s. The leaders and leadership emerged in response to period and socio-cultural change that's both in medical and business. Up to late 40s, the believed leaders were born, not made, and had particular traits. So they believe that leader is born by nature. Since 2nd trimester or 1st trimester, that's leader. Inside his mother, he's a leader. That's what's the thought. And I think even in the Middle East, still that's believed until now, engaged in our brain. From late 40s until late 60s, the belief was how the leaders behave that matter, the question of style and can be real, and start to be some organization to be built now, how to put the leaders that study more and do more research in that, and start to publish more books about the leaders. In my opinion, I think there is a difference between leaders in the business and leaders in medical. We still beyond the line if you compare ourselves to the business. Business people, I think they are so advanced in the leaders, especially when I work with them and meet them. That's what my feeling of my area. Maybe in Canada here, I think the leaders in the medical, they are more organized, having more knowledge and more training for that. Still, I think that's in my area, and we need to build it more and more about the people. So, if you can divide yourself into, I think you are 9 or so every 3 groups. Every group having 3 persons. If you can just discuss with the next minute, what are the rules for leader in health education? And here is something. So can you discuss that now? Divide yourself into 2 or 3, and give me like 1 or 2 rules for leaders in health. Yeah, you can do the same.
Same group as your published.
Five, 4, 3, 2, 1, action. Anyone can start, right or left? Or middle? Oh, middle. We didn't choose middle. Anyway. As you know.
So, of course, all of the concepts of leadership we do agree to, but one that we didn't see was support. We found that support is key to having a leadership role, especially working in a healthcare facility setting.
We also added the idea of being a facilitator. I think teamwork is important, but having that person to acknowledge what the different roles are and just have that common person to provide that support and help facilitate towards that common goal.
So you said things like, so we're kind of separate, and I know you guys are going to get into it with like managerial sort of duties versus leadership. So like the managerial stuff, it would still be beneficial. Like in order to achieve the overall vision that the leader has, it may still require some sort of organization of the way things run. So when we're thinking with the board example, a person who leads, who has maybe a vision for IPE, might do certain things to make sure that the permanent board staff are aware that that learner is coming and linking all of the professions and things like that. So that could be part of their overall leadership vision, but still involves some administrative tasks.
We talked about creativity too, which is kind of part of the vision, like leaders should do something new or like break the barriers, think outside of the box instead of just doing the rigor stuff.
Kristen, she knows what we are going to talk about. Appreciate it. She was
I was here when they were figuring out eye clicker the other day.
Okay, yeah, so we started with just the basic medical knowledge. So leaders in medical education need to be experts and have the knowledge and be able to pass that down to their team members, and be able to establish the goals and objectives of their followers, and ensure basic competency. Overseeing communication, role modeling the effective communication amongst their learners,
Good community.
and motivating them as well.
Probably. Okay. By the way, Helen, I think she shared one paper that I'm going through, and that's recent. I touch it. So, in summary, what you say, I absolutely agree with the answer now. The roles of leaderships and health development as a head for that, you need to act this picture. Adjust the rhythm of the team, he's supposed to that, and make him like working as a one unit. He should pull and motivate the teams together, what as you said, and encourage them and lead them by rules and by talking or whatever. Help him and make the role by walking for them. And like this one, you should align your team as a leader here. So that's why I'm always thinking about leader. It's not something simple, it's something difficult, and that's why I don't like it. I like to study it, I like to read it, but I don't like to read it. Oh, next slide. You want me to talk or you want to talk? I think this is excellent, brilliant article. So I think, this is, I think, that's one of the articles for Helen, that's preparing leaders in health professional education. I tell you why I was interested, because she talked about not only the developed country, she was talking about even the developing country, and in general, how is the importance of leader in developing medical education centers or institutions. And compared by the Health Education Institute, for a long time it was started by 7 and now almost like 127, something like that, and start being more organized. And how is that helping the students, residents to build their knowledge? It's very important to build your health institutions, and also how to build the leaders there and how to choose to lead the institution. Did they say something wrong? One thing is also more I like in that article, that's being a good clinical teacher is not enough. Independent institutions also need education leaders and scholars. Developing medical education leaders need to be strategists, scholars, because of environmental and professions. Okay, if you can just discuss this one, thinking on time. What is the main challenge that's going to face you if you are being a leader in any health institution? There's many things.
I think as medical leadership, one of the biggest challenges I find is trying to, is the time. You know, when you're challenged to be clinician and teacher and researcher
And mother sometimes.
yeah, so just trying to find the right balance.
Any other idea?
I think you came up earlier with the whole orientation and whose job is it? Who's going to take on that role? If there's so many people involved, who's going to step up, and how does that happen?
And I think you also mentioned too that a lot of the time we often sort of grew up thinking, okay, some people are leaders and others are not. So if you are one of these people who's always thought, okay, I don't have that trait, and if you haven't sort of learned skills to be a leader, then that's certainly a huge barrier.
So lack of skills on how to do things. And
The administrative system is not very well built for doctors to be leaders.
I agree with
It might be a little bit different in Ontario, but it seems similar. So it seems like the doctors are under like the medical services director or whatever, or something like that. They report to the committee of doctors, dentists, and pharmacists, but they don't really, like they're kind of in the parallel administrative system as opposed to the allied health nurses and all the other workers in the hospital that relate to more of the regular administration. Both of them work in silos, don't talk that much with each other. Sometimes the people with the funding for the hospital administration will not talk to the doctors about what would be good to improve the care, and vice versa. Doctors will send their doctors or will get new skills or education on some stuff that is not available in the hospital. So it's very complicated to get those two together.
So if it were working perfectly, it's supposed to be a symbiotic relationship. But it is that sense of it really is two different organisms working with each other, because technically the doctors in the hospital, you could think of them as symbiosis, or you could also think of them as parasites. Because your contract, your boss is never theoretically directly the president of the hospital, except in some countries, like Japan, I would say, because there are no Japanese people here, and I know the system pretty well. In Japan, the Minister of Health is everybody's boss. Everybody is paid for, paid by, responsible to the Minister of Health. The licenses come from the Ministry of Health, et cetera, et cetera. It's very clear there that it's a very well organized system, and everything goes back to the Minister of Health. Whereas our system is independent professionals. So it's not just the doctors that are parasites in the hospital, also dentists or midwives. There are a whole bunch of people who are not directly, in the past, hired by and responsible to the president or the board of the hospital. However, in Ontario, at the moment, there's a big power struggle. And the presidents of the hospitals are trying to take over more and more of that, and our Ministry of Health is supporting that. So stay tuned, because 20 years from now, what you see as a current confusion and problem disadvantage may disappear, but we may not be happier. We're totally responsible to the Ministry of Health.
Working as a video man, and with that it's kind of time. Okay, thank you very much. So this is some examples about how the individual, how to work and to counsel caring for an individual patient and leading a microsystem, because the hospital need like a microsystem to work with that, micromanager sometimes. As you mentioned, the lack of institutions to value to place on medical leadership and to sharpen the skill and the leadership. And still, I mention it again, I believe the business people, they having much advance than us, the business, we're having good institutions and good education hearing about how to do business and how to be leader of that. And many health care workers lack the skills and training the system to take a leadership role. But unfortunately, many of them, they are forced to be leaders because nobody can take that place, and they need to collect the resources. Somebody should be managing the resources in the hospital or in the education area. Last thing, that's how to prepare healthcare worker to be an essential component of running an effective healthcare organization. Also, yeah, I think this is very important about inadequate time to study the leadership skill. So, I'll come to this. Thanks, Christine. I will spend time on this one. So the difference now between manager and leader, you have question for that, because you should think the doctor in which area. He's a leader or a manager or what? So from manager point, he's trying to do things right. The leader always striving to do the right thing. And manager not happy unless things are running smoothly. The leader not happy unless things are changing for better. the manager recovering from change, but the leader like to drive into change, promoting efficiency, the other side promoting effectiveness, having answered the manager. But the leader here is so brilliant, so having questions need to be answered. Is a process organic? Do ordinary things well? The leader is trying to do extraordinary things well. Organizing, staffing, is alignment, autonomy, planning, accepting of reality, strategy, visionary. Manager think about today, but the leader think about tomorrow. He's risk advisor, the manager, the leader is risk taker, is being competent, and the manager continues clearing, controlling, problem solving, and motivating, and inspiring. That doesn't mean leader is better than manager. Everyone having his own role, and he should work in that area according to your genetics, according to your beliefs, according to what you have from the skill. In general, so manager provide a degree of predictability and consistently deliver short-term results. Leader produce a change and have the potential to make highly significant impact within an organization. But as I mentioned before, it doesn't that mean the leader is better than manager or on the other side. Everyone has his own way. So.
May I ask a question with that last slide? Did that come? Where did this slide come from? Was that from a business model, or did you take that right?
From many business.
Okay.
I didn't have to something significant in the book. So can you please divide yourself? Think about position as a leader, or manager, or change.
Health professional.
Health professional.
Yeah.
Sure, but position always think of my mind. So you have the paper on your leader, business manager, and if you believe if a health provider, he can be both leader and manager. I will give you an example, like manager, for example, the resident, he can manage his schedule in hospital. He can manage the resources that he has to do his work. Leader position sometimes like you want to do like, for example, leading the team, leading the process or something. So from perspective of you, what do you think that is a healthcare provider can be to leader or manager or both? If you can stand, please, and choose which area. But the manager?
What is the main role of a healthcare professional? The manager, leader, or what is their role as a healthcare professional?
Oh,
You know, you showed us.
sorry. No, sorry.
Okay, can we,
Yeah, I'm the devil's advocate.
What?
Nobody's thinking.
Because nobody's.
Yeah. Can argue this one.
Oh, okay.
ladies first.
Okay, so like the main role of
Yeah.
okay, this is
I
hard
think it's
because
main
it's not
role,
really my
main
choice,
function.
but I'm gonna pretend it is. I think like, okay, so let me think about this. I'm just thinking of the majority of healthcare professionals in communities, like when you think of the percentage who, like not everybody can lead. It takes followers as well. And in leadership, sometimes you're doing managerial things, but sometimes that work needs to be delegated. So if you look at the percentage of physicians in Canada, and which ones, like the proportion that actually serve leadership roles versus the ones that have to participate in the managerial duties, I would imagine that a larger percentage have to deal with the mundane stuff. And you can't have like a million different visions if you want to get anywhere. So you have to accept a following kind of role sometimes. Anyway, that's really hard to put a cogent series of arguments together because I'm more on that side, but just to be devil's advocate.
Fill the gap.
Yeah,
That's
fill the gap.
Excellent.
Once again, I think both would be answer for everyone, but you asked for the main one, and I tend to think that we should be, at least some of us should be more in the leader role. And not all healthcare professionals will be neither managers, neither some of them will just be workers, and that's fine. But if there's a role for healthcare professionals, I think from their training, it's more to raise questions, see what's going wrong or could be better, having kind of dreams, aim for better patient care, try new stuff, than running the day-to-day, which might be more administrative. People sometimes having, and ideally having healthcare professional experience before, because it will be more knowledgeable about what's going on in there than just aligning numbers at the end of the budget. But I think the role of those healthcare professionals that have the healthcare professional training is probably more leading and thinking about tomorrow than thinking about today if they are in a leadership position.
Yeah, I agree with Matthew. Of course, it always requires us to kind of always go to both roles because when we are doing our work. But I think one needs to have the outlook of a leader in whichever position you are. I just feel it helps you to remain focused, not get bogged down by the mundane things of life. And I can speak of that as a mom too, because I feel that if I'm going further, I will just, my whole day will go in nagging and going after the small things, and the bigger picture gets lost. So I think dealing with people at our work also is part of that. Look at the big picture, think of tomorrow, is what I'm doing actually taking me towards my goal. So I think we need to have an outlook of a leader while managing our stuff.
So I think it looks from your thought it's between leaders and the manager.
No, I feel that you should always think like a leader.
For me, I agree. I think, like you said, while we're managing, we're leading as well. Just a day-to-day example is I'm managing somebody's diabetes today, but I'm also thinking, well, how better can I run my diabetic day, or how better, So you're maybe micromanaging, but you're always still thinking, well, how better? And I think as practitioners, we just naturally do that because we want our day to run efficiently and smoothly, and we want the best for our patients, and we want, to use everything efficiently. So I think it's a balance on a day-to-day basis.
Yeah, it's almost like the leading is sort of like thinking about, like when you compare what's a goal versus an objective, it's almost like leading is like the goal. Like ideally, if everything's going well, like that's where we want our mindset to be. But in order to get there, we have to be managing everything at a competent, smooth level, because otherwise we'll never get there. Otherwise, you're just sort of a dreamer without sort of doing the tasks that you need to get there. And when I think about my program director, I think I see how he does the managing side of things really, really effectively, so that he can have sort of visions for like what our program will look like in the future. But I certainly can appreciate all of those little details that he does on the managerial perspective, and especially things like when you're sort of limited with resources, and he has a very sort of realistic approach that he takes. And I think initially I would have always sort of focused on the leading, and I realized how important the managerial side is once you're in the role and you're the one sort of having to manage those things.
Yeah, for me, I think leaders are more like thinkers, managers might be more doers. And I think to have a good outlook on the future, you have to, the present or the past is a good marker for the future. So I think to be a good leader, you should be a good doer and to acknowledge, what those issues are in the short term to really plan for the long term.
I think the biggest thing is, one thing I've learned being staff is I actually wear lots of hats. I manage my own team. I have to be somewhere for a certain meeting. I take on some administration roles, so you're leading teams. You do so many different things that's why I went with both. It's not one or the other.
The reason why I chose both is because there are healthcare professionals who are in a managerial position, but at the same time, like speaking from experience, I see my manager
having leadership roles and qualities, like continuously learning. My manager is continually learning, but at the same time motivating and inspiring her, her employers or her employees to, continue school and so forth. So it's both. It goes both ways.
Actually, there is nothing called white and black.
Yeah.
So yes, all of us. I mean, we did some sort of the leaders works and manager work. So yeah, I mean, we cannot be. I mean, as I mentioned, white and black. I mean, we are doing all of these, but some they were prepared to be as a leaders, as Marco and some they. I know you are just doing the job. Some they were prepared to be as the managers, and most of us, even the distribution of the number, you can see that most of us we are in the board positions.
You can see the ones wearing stripes around the side.
But everybody would be kind on the both, but there's a trend towards more leader.
Yeah.
If I understood it, because
I
even
think
you
this is a
got
trend
to the
for
manager side,
leadership
but
in this class.
Yeah, that's true.
Specific population, so.
That's a good point.
Next slide, please don't be upset for me, because I don't have clear answer from my side. And I think, that's my opinion, the healthcare can be both, from both sides. As a manager, that he should manage the things that he have it, and also at the same time he should be leader. So from that point, I review the CAMMETS, the draft now for CAMMETS 2015, which is including the leadership in that area. And it will be under manager expert. So that's why I'm asking you, let us wait for CAMMETS 2015. I think there is many surprise that issue. The manager expert will increase the emphasis on leadership competencies on CAMMETS framework to better prepare residents and physicians for their role as healthcare leaders. I think that's fine. We will be a leader. We can compete now with the business people.
Can I ask another question, just because it came up in one of the committees I was on, and I don't know who's physician and non-physician here, but if they change one of the CAMMETS roles to leadership from management, how is that going to impact interprofessional education when they try and design that in terms of curriculum design or wherever you want to use it? Because does that then mean that they almost are, they've been working hard at thinking of becoming interprofessional, physicians have anyway, and then we're going back to saying now we're not going to be managers, we should be leaders, whereas that's very territorial. So how do you, can you comment on that in terms of what you think of, you've just presented two perspectives, becoming more interprofessional and maybe not being the leader of that curriculum, and then now being, CAMMETS is saying we should go back to being leaders, not managers.
Okay, from this point, it's kind of, I think that's natural, everyone has his own role. Some people they comfort to be a manager, like that's the area here. If you've been like, I don't like to be a physician, to say like healthcare provider. As decision about allocation resources, scheduling their time, their schedule, rotation, managing the budget, managing their practice and career and their resources. And the other side, the leaders that can provide the vision, enthusiasm, communications, confidence, and inspire and influence. And that's very important in health education institutions. We have a good leaders. I need to improve the institution. I don't like to come to this health center now, and after 10 years, it's the same. There's nothing wrong, there's nothing changed there. And that's the role of the leaders, inspiring and changing for leaders. Manager can control the area, what we have it now, and make it stable, and make sure everything going right. I think also the manager, we want to make sure what we gain, we are not going to lose it. So he will save what we have it now. So we are not going to lose anything. He will save it. Leader, he will add something to the institutions for that.
But do you think that's going to be a conflict with what we discussed for interprofessional education, because the physician won't always be the lead?
Yeah, I think that, I personally think that it's sort of more of the mentality, sort of what Annika was alluding to within her choice of leadership within the leader managerial role. I think that the idea of being inspiring and sort of thinking forward. I think that that can come within every individual, despite, you know, the idea, apart from the idea of being like CEO of the hospital or you know, program director. I mean, I think that the ideas of being both are sort of the real value of the idea of leadership. But I don't necessarily think that that should influence, as long as that is not interpreted the wrong way. I think that hopefully that's not going to make the physician who becomes a manager / leader, the person who feels like they're the one that needs to direct everybody else, because that's, you know, that is not in keeping with what we're saying about interprofessional education.
I just have a question about this discussion that was brought up. Why would it be the inclination for it IPE to be related to managing versus leadership as opposed to collaboration? Because to me, IPE falls under collaboration, and if it's a collaboration of leaders from different professions, but to come in, and I think there is a lot of development in other professions over interprofessional. Like, I think some of the college programs, not certain, but among allied health, they actually are collaborating, and we're the last to jump on. And so if we come in waving our flag saying, well, we're the obvious leaders, like, I just feel like, so I just don't understand why, because in my mind, IPE, I go to the collaboration route as opposed to changing manager to leader.
All I know is this was a controversial point at one of the committees that I was involved in, the CanMed role, changing it from manager to leader, when it took a long time to arrive at thinking physicians should be good managers, not necessarily always the leader.
Right. So this would be going
So
the
this
other
would,
way.
the perception was it was going the other way. It was taking a step. It was actually pushing back into a prior day. Most committees and things were managed by physicians, most education initiatives, hospital changes were led by physicians, which maybe they should or shouldn't be, I don't know. But IPE, I think, would be interesting to see your thoughts, and I don't want to steal any more of your time. It isn't always physician initiated, and someone has to be the leader. But it isn't all, I mean, just to get things done, someone
Right.
has to coordinate things, just technically, you just need the processes in place. So this was perceived as being a step back by changing the CanMed role from a managerial role to a leadership role, particularly in the context of interprofessional education.
But leadership is not necessarily the thing on one person. So what if, like, nurses, respiratory technicians could include leadership in their role too, and all the health professions should have leadership included in their roles and have a share of leadership. Doesn't mean because one person is a leader, the others aren't. You can have a team without a captain.
How well would it run? How well would it run though without a captain?
The New York Rangers are in the Stanley Cup final without a captain. And they said, it's a sport example, but they said in the news, because it was kind of, I think it's the first time that a team makes it to the Stanley Cup final without a captain. Like, everybody thinks like the captain is so important. They said, well, the coach said, I didn't mean captain, because my leadership comes from all of my players, and maybe 5 or 6 of them, and they step up at different moments depending on how the situation is. So I don't think because the physician would be a leader, that the nurse or the physiotherapist or the nutritionist wouldn't be one.
And I don't
at the time that it's necessary for them to.
And I don't think that, you know, I think you get the most when you get leaders from each profession to collaborate. And just because physicians are calling it leadership shouldn't, and others aren't, shouldn't mean we shouldn't call ourselves leaders. I think there should be designated leaders from each group collaborating together, and I don't think that should prevent us from calling ourselves leaders. I think that leaders need to step up from each area and be involved in collaborating.
One more it's interesting now in my country now, because we have problems with the coronavirus now. The king was very upset from the leader in the Ministry of Health. Actually, the ministry was almost called, the leader almost physicians since long time, since I think 1985. The position always called physicians. And now this is the first time the king just asked Dr. Abdullah Rabia to leave the place, and he inserted now another business leader here. And we start to feel now some improvement, outcome out there at the same time. I don't know, that's still, I think we have still the fit in the leadership skill.
So this is a question that anybody can write into the Royal College at the moment, and you can give them your opinion because they are trying to decide it. I had, until the moment when asked the question, I shared her concern. And what I did was I just went back to read the definition that is currently in the CanMeds for manager. And I accidentally had to read through collaborator first. And what I think I'm beginning to realize is that the only petal of the flower that's under debate is the manager one. Collaborator is staying. So if you look at their definition of collaborator, and it says, as collaborator, physicians, and they mean Royal College physicians, effectively work within a healthcare team to achieve optimal patient care. So it may be that a lot of the things that we think are kind of management things and IPE kind of things are actually still safely there in collaborator. And the question now being addressed is the leadership skills side, to balance out the manager collaborator things, to have both. You actually have to say that the other petal needs to be leadership because the collaborator, maybe, if I'm being generous, is already being accommodated. Manager and collaborator kind of cover each other off. So I hadn't looked at it that way before, so it was a useful question to ask. As I say, I think we all need to be thinking about it, and any of us can write to the college and give them our opinion, because they haven't decided yet, right? We're not waiting for CanMeds 2015. They're asking everybody to build it together.
And they put in the website, please, what do you say today? And your answer, please submit it today.
Step maybe.
Slide. So the genius question now here, do the people who want to be a leader, is it possible to be a leader? So my question, is it genetic or can it trained? Is it individual to work as a leader, or you should work with your team? What do you think? I have only 1 minute because we are beyond the line. What's that?
Like, I think it's like anything where some people, it might be a little bit more inherent for them. They gravitate to leadership positions and they have an aptitude for it. But